This is Stephanie Huff, and I am recording a concept on stress and coping. This one is on anxiety disorders. So, an overview: anxiety is a stress response that is characterized by feelings of mental uneasiness, apprehension, dread, and a feeling of helplessness related to an impending or actual threat to their self or significant other. Anxiety generally helps individuals cope. It's a part of daily living. But when normal feelings of anxiety get out of control, then anxiety disorders may occur and impair the individual's functioning. It does affect about 20% of the population. Looking at the pathophysiology, people are more likely to have anxiety disorders if their parents have anxiety disorders. Your biological and environmental factors may play a role in the development of these disorders. It does affect individuals of all ages. It can be a predominant disturbance. Some of your medical problems that can be hormonal or neurologic that can cause the symptoms of anxiety. There's what's known as free-floating anxiety, which is an excessive worry about everyday events. They worry that is hard to control, and the focus may shift from moment to moment. And that's why it's called free-floating, just because it shifts randomly. Your anxiety disorders are going to be generalized anxiety disorders, separation anxiety, and panic disorders, and we'll talk about those a little bit more in detail. Etiology: vulnerability refers to the individual's susceptibility to react to specific stressors. Etiology: there are some neurobiologic theories and the role of the brain. Each part of the limbic system plays a part. So the amygdala is known as the emotional brain. Anxiety, fear, and anger are elicited in this area of the brain. The hippocampus stores memories related to fear. The locus coeruleus stimulates arousal, and it contains half of the neurons that use norepinephrine, which is a neurotransmitter. Your hypothalamus actually activates the heart rate and respirations, which are controlled by the brainstem. And then the thalamus integrates all sensory stimuli. All right, your neurochemical theories. This is communication within the brain. So the brain's benzodiazepine receptors system enhances activities of GABA, which is an inhibitory neurotransmitter that basically shuts down or slows excitability in the cells. These are found in the locus coeruleus, where the norepinephrine is produced. Your norepinephrine is an excitatory neurotransmitter that signals arousal and hyperarousal. Neurotransmitters are chemicals that deliver messages. A lot of times an imbalance between your GABA and your norepinephrine will lead to the development of anxiety disorders. Your ligands, these are anions or molecules that binds with other molecules. Your psychosocial theories, they view anxiety as a sign of internal conflict resulting from threatened emergence of repressed emotions into consciousness. Anxiety occurs when the ego attempts to deal with this conflict. Your behavioral theories, the behaviorists believe that anxiety is related to faulty thinking and learned dysfunctional responses, and that people can unlearn unhealthy behaviors. Your genetic theories believe that genetic predisposition and family history will play in the development of anxiety disorders. Your humanistic theories, various causes such as biological, psychological, behavioral, and genetic causes interact to produce complex symptoms. Risk factors. Childhood adversity includes witnessing a traumatic event that can cause them to develop anxiety disorders. Family incidents, some of your social factors like lack of social connection. And so these are people that are not, maybe like if they're homeschooled, but they're not able to interact with society very much. And so once they do get out and start acting and participating in things with society, they become very anxious and can develop anxiety disorders. Some of your serious or chronic illnesses are risk factors, traumatic events, your personality factors such as shyness and worrying, multiple stressors. So if they have chronic illnesses concurrent with like loss of employment, that could lead to an anxiety disorder. Children, anxiety disorders are reported more frequently in girls than boys. There's a family predisposition. I'll show your economic factors. Usually low socioeconomic background is at higher risk for anxiety disorders. Your older adults with cognitive or chronic physical impairments have an increased risk for anxiety. A significant emotional loss like death of a spouse, low education levels, if they have multiple chronic illnesses, or being unmarried, so they have no support system or somebody that's with them all the time at home. Prevention is dependent on an individual's knowledge of their growing anxiety. They should seek help early. It's harder to treat as the anxiety and the disorder progresses. They need to keep track of patterns of worrying to help stop the anxiety before it gets out of control. Because sometimes if they're not keeping track of this, then they don't realize that things can kind of escalate before they even realize what's going on. So this just kind of makes them more aware of things that cause them anxiety and cause them to worry. You would advise that individuals keep journals to catalog those stressors and sources of relief. You want to advise avoiding unhealthy substance use such as alcohol, illegal drugs, nicotine, and caffeine. All of those have just been found to play a role in anxiety. Your clinical manifestations, anxiety can be classified as mild, moderate, severe, and panic. So we'll kind of go through those. In mild anxiety, they will have an increase in sensory perception and arousal. They have an increase in alertness and motivation. They may have some restlessness, irritability, and sleeplessness. In moderate anxiety, they have a narrowing of the perceptual field and attention span. They have increased restlessness, increased respirations, and sweating. They usually have a feeling of discomfort and irritability with others. May have a decrease in alertness and awareness of their surroundings. They have talked about the increased respirations, but they also have increased heart rate and muscle tension. May have rapid speech, louder tone, and a higher pitched tone than normal. In severe anxiety, their perceptual field is greatly reduced. They have difficulty following directions. They have feelings of dread and horror. They have feelings of needing to relieve anxiety. They may complain of headaches and dizziness, nausea, trembling, and insomnia. They may experience palpitations, tachycardia, hyperventilation, and diarrhea. In panic anxiety, they have an inability to focus. Their perception is distorted. They have terror and feelings of doom. Usually they have a bizarre behavior, dilated pupils, and diaphoresis. They have trembling, sleeplessness, palpitations, and pallor. Usually they have immobility or hyperactivity, so it's one extreme or the other. They're usually incoherent and have muscle incoordination. So looking at generalized anxiety disorder, they go through their days filled with an intense tension and worrying, even if there's no external stressor present. So basically they just worry about everything. They have a pervasive apprehension and worry. It's usually diagnosed when excessive anxiety goes on for at least 6 months. They usually have difficulty relaxing, usually complain of fatigue, have poor concentration, irritability, difficulty falling asleep. They may anticipate disasters and or have preoccupation with health issues, money, family problems, or work-related challenges. So a lot of times, even if there's nothing going on, they worry, and it's like that picture, what if, what if, what if. Everything may be going great in their life, but it's always like, well, what if this happens, or what if this happens? They usually recognize that this anxiety is disproportionate to the circumstances, but they can't get themselves out of it. So children with generalized anxiety disorders usually have an intense worry over a long period of time and are under a significant amount of distress. Your separation anxiety disorder is the most common type manifested by children. They will have an extreme state of uneasiness with unfamiliar surroundings or people. They usually refuse to sleep alone or attend school. A lot of times they will have repeated nightmares with the themes of separation being the main theme of their nightmares. They usually have excessive worry about family members, worried about what if they die, and they may not even be sick. The symptoms of fear will last for at least 4 weeks. Usually the onset is before the age of 18. This is more severe than your normal separation anxiety that occurs in early childhood. They may also have physical complaints such as muscle aches, excessive worry, excessive cleanliness, even when they're at home. There is an adult form of separation anxiety disorder that has been newly recognized, and usually is first onset in adulthood, but some actually persist from childhood into adulthood. Panic disorder. These are sudden attacks of terror. They may have pounding heart, sweating, fainting, or dizziness. Usually the attacks only last about 10 minutes. Sometimes they're less, and sometimes they can last up to an hour. They're typically not associated with any kind of stimulus, so they just kind of happen out of the blue. Sometimes they'll even happen during their sleep and they wake up with it. They occur suddenly and spontaneously. They have a fear of one's unexplained symptoms, because basically all they know is things are going on. They're sweating, they feel faint, their heart is racing. Sometimes in these panic attacks, they may feel flushed or chilled. Their hands may tingle or become numb. They may have some nausea, chest pain, sense of breathlessness, fear of impending death, or terror of losing control. Sometimes if they're starting to hyperventilate with these panic attacks, they will have what's known as carpal spasms, and so that's where their hands kind of draw up. They usually have an intense worry about the next attack, and they're still maybe going through this one, and then a lot of times that's how the next one occurs, because they just kind of get themselves so worked up about it. These can be very debilitating if treatment is not sought. Collaboration. Treatment is likely to occur in the home and the community rather than in the hospital setting. It does include individual and family. Nurses need to support positive outcomes for the individuals and families. Diagnostic tests are based on observation, as well as looking at a physical exam and a complete medical history. There's no lab test available to diagnose anxiety disorders. Usually they may do some lab tests to rule out other physical illnesses as the cause. They need a referral to a mental health professional that's trained to diagnose and treat mental illnesses. Your pharmacologic therapy is used to control symptoms while the client enters psychotherapy. Your anti-anxiety medications may be used sparingly. Your benzodiazepines are a type of anti-anxiety drug. They have been effective with fewer side effects than some of your other anti-anxiety medications. The main ones with your benzodiazepines is drowsiness. Some of the examples would be alprazolam, which is your Xanax, diazepam, which is Valium, lorazepam, which is Ativan, and chlordiazepoxide is Librium. All of those are types of benzos that have been effective. Usually it's taken short term and no longer than a year, but they do have possible withdrawal symptoms if it's stopped abruptly, so that's one of the things they have to taper off before they stop taking it. Other medications that can be used for your anxiety disorders are going to be antidepressants, beta blockers, your SSRIs. Those are your antidepressants. Those are usually the medications of choice. They usually start at a low dose and increase it to get to the desired effect. A lot of times they have, these usually have fewer side effects than some of the previous antidepressants that were used besides the SSRIs. Your beta blockers like propranolol are used to treat the blushing and hyperventilation, which can accompany anxiety. Some of your antipsychotics may be used, but they're usually reserved for bipolar disorders and schizophrenia. An example would be haloperidol, loxapine, chlorpheniramine. There's a newer anti-anxiety med called buspirone, and it's used to treat generalized anxiety disorder. Side effects of it are going to be nausea, headache, dizziness. It must be taken consistently for 2 weeks to achieve effect, whereas your other anxiety, like your Xanax and Ativans and Valiums, those usually work pretty much right away. But they are have a lot more side effects and are a lot more, have a higher risk for being dependent on those medications and addicted to those. So a lot of times they'll try to go with this buspirone because it can be used a lot longer term. Your non-pharmacologic therapy, cognitive behavioral therapy, which we've talked about before, but this is teaching the client internal locus of control, developing goal-oriented contracts, helping the clients test reality, and there's also a coping toolkit that can be used. But the cognitive aspect of this theory treatment helps the patient change their thought patterns that support their fears, and the behavioral aspect helps the patient change the way they react to the anxiety-provoking situations. And so basically it just helps reduce the symptoms in all types of anxiety, this cognitive behavioral therapy. Alright, so other things, your herbal preparations show little promise as potential therapy for decreasing symptoms of anxiety. Massage and therapeutic touch therapy will help decrease anxiety, blood pressure, and heart rate. On your herbal preparations, there is one called Kava, which is Kava. It may help some, but it is also linked with severe liver damage that is associated with dystonia, drowsiness, scaly yellow skin. Lavender may help relax and decrease anxiety levels. And so a lot of times people will use lavender in soaps or in diffusers in their house. Chamomile can help with generalized anxiety disorders. Your relaxation techniques will help relieve stress. When the body relaxes, breathing will slow, blood pressure and oxygen consumption will decrease, and their well-being will increase. Yoga and meditation are also used as types of relaxation techniques. Yoga helps maintain well-being, improve fitness, and relieve stress. Meditation is used to combat the effects of anxiety. Some people have had good results with the use of acupuncture in decreasing anxiety. Nursing process provide case management, home health care, psychoeducation, and medication administration. Assessment. In the health history, you want to get current and previous illnesses, looking at their medications as well as their supplements that they are taking daily. You want to get past and present stressors, current and previous coping mechanisms, including the use of alcohol and drugs, because sometimes that's how people cope with their anxiety. They may drink alcohol, or they may use drugs to kind of help them with that. Physical assessment includes general assessment and focused assessment to address specific complaints they may have. These are your NADA diagnosis for anxiety. In planning, your client will report a decrease in level, frequency of their anxiety. They will articulate successful coping mechanisms, report increased use of successful coping mechanisms. They will participate in psychotherapy or group counseling activities. Implementation for those with mild anxiety, focus on appraisal. So you want to get information about how the patient appraises and prioritizes their stress. You want to evaluate thoughts that may increase anxiety and teach them ways to manage stress and modify their thinking process and behaviors. For moderate anxiety, you want to provide information for cognitive reframing and physical exertion to expend excessive energy. So that may be taking brisk walks, running, working out large muscle groups. Need to intervene appropriately to prevent panic from occurring. So severe anxiety and panic require one to intervene immediately. May have to isolate the client to avoid distressing other people, making sure that they have a safe, quiet, protective environment. Don't leave them unattended. Administer medications as ordered. Usually benzodiazepines are used because they will work quickly and kind of calm them down. You want to encourage health promotion strategies through regular exercise, balanced nutrition, a balance in their sleep rest patterns, so helping them and teaching them strategies to promote relaxation and sleep. Time management, they may need help with schedule modifications to balance their responsibilities at work, family, and school, and still have time for rest, socialization, and extracurricular activities that they enjoy. Evaluation. Client anxiety will have diminished as reflected by vital signs returning to baseline, and patient's report of anxiety level has decreased. The client has demonstrated new or improved coping mechanisms to reduce their anxiety, and the client self-moderates anxiety responses when stressors do occur. All right, and so here is a question. So Mr. Jones, or Mr. J, has a panic disorder, and it appears that he is having some problems controlling his anxiety. Which symptoms concern you the most? A, his heart rate is increased and he reports chest tightness. B, he demonstrates tachypnea and carpopedal spasms. C, he is pacing to and fro and pounding his fists together. Or D, he is muttering to himself and is easily startled. And so basically, all of these are some symptoms of panic disorders and anxiety, and so you just need to figure out which one is the worst. And so, like on A, he has increased heart rate and has some chest tightness, which you will see with some of your mild and moderate anxiety. But the one that causes most concern is C, and that's because he's pacing and pounding his fists together. So he is on the verge of potentially harming himself or someone else. And so those are the ones that are going to concern you the most. B is those carpopedal spasms that you'll see in the hands and feet, but most of the times you see them in the hands. They're breathing fast or hyperventilating. And so a lot of times people will have them breathe in paper bags. If nobody's there and the patient can't talk themselves down from anxiety, basically the body will take over and cause the patient to pass out, and that will kind of reset their breathing and cause them to breathe normally again, because when they're hyperventilating, they're not getting good perfusion and the body is trying to take care of vital organs and the rest of the body, so they will try to take care of things because the patient cannot control themselves. All right, and so that's the end of anxiety disorders, and as always, if you have questions, please let me know and I'll try to help clarify.